Hello Pharmarians, we are discussing antiplatelet drugs. In the previous video, I have discussed what happens in a normal blood vessel and what happens in a damaged blood vessel. Now let's move on to the antiplatelet drug classification. This is the classification of antiplatelet drugs. Before going to know their mechanism of action, let us see what happens in a platelet. When the platelet gets mechanical or a chemical stimuli, the phospholipase A, which is present in the membrane phospholipid, releases arachidonic acid. And this arachidonic acid, with the help of cyclooxygenase enzyme, releases prostaglandins and thromboxanes. And with the help of lipooxygenase enzyme, it releases leukotrienes. Now let us move on to the mechanism of action of the drugs. First one is aspirin, which is an irreversible cyclooxygenase inhibitor. Firstly, this arachidonic acid, with the help of cyclooxygenase enzyme, releases prostaglandin H2 and metabolizes into thromboxane A2, which is helpful for the activation of platelets. So this aspirin, what it do is it inhibits the cyclooxygenase enzyme and prevent arachidonic acid from producing prostaglandin H2. This is how aspirin works. Coming to the second category, platelet aggregation inhibitors. So in the previous video, we have discussed that the platelets releases chemical mediators like ADP, thromboxane 2, serotonin, etc. The released ADP binds to the receptors of platelets named P2Y12. When these both forms a complex, it activates glycoprotein 2B and 3A receptors to attach to the fibrinogen. So this is a general mechanism, but what these drugs do is they inhibit this ADP and P2Y12 receptor complex formation, so that there will be no activation of glycoprotein 2B or 3A receptors and there will be no interaction with the fibrinogen. Now coming to the third category, glycoprotein 2B or 3A antagonist. What they do is they directly act on the glycoprotein 2B, 3A receptors and they inhibits their interlink with the fibrinogen. And coming to the fourth category, phosphodiesterase inhibitors. Under this we see dipyridamole and silastazole. In platelet, what we see is this cyclic AMP get converted into AMP with the help of phosphodiesterase enzyme. Now what these drugs do is they within the name we can see phosphodiesterase inhibitor. That means they inhibits the phosphodiesterase enzyme so that the cyclic AMP is not converted into AMP. So the levels of cyclic AMP is increased, because of which the calcium levels are get decreased and the platelet aggregation is also decreased. This is the mechanism of action of antiplatelet drugs. Now let us see in what conditions we use these antiplatelet drugs. The first category is coronary artery disease. The second one is cerebrovascular diseases. Third one is coronary angioplasty, stents, bypass, implants. Fourth one is prosthetic heart valves and arteriovenous. Fifth one is venous thromboembolism, and sixth one is peripheral vascular diseases. And these are the conditions where we use antiplatelet drugs. And that's all for today. Thank you. If you want the notes of these antiplatelet drugs, please do watch the next video where I keep only the notes. Okay, thank you.